Hello, hello, hello. Hi, everyone. Hello, welcome, welcome, welcome. Welcome to a special edition of Q&A with Dr. Mercy. I'm Dr. Mercy, and thank you for joining me. Hi, everyone. I hope you guys can hear me very well, and thank you for joining. Again, thank you for joining Q&A with Dr. Mercy. Happy Friday, happy Friday. Let me make sure that I am being seen. I think I am, but we'll give some time for people to gather. Hello, everyone. Welcome, welcome. If you are seeing me, if you could please jot down in the comment section where you are viewing this. Hello, welcome to Q&A with Dr. Mercy. I am Dr. Mercy. If you are seeing the live video, if you could comment on the comment box that you can see it so that I may be able to make sure that it is live and direct. Hi guys, hi. It's been a minute, but I just wanted to hop on. Hi, okay, hi Alicia. How are you? Thank you so much. Hi, Pennsylvania. Nice to see you. Thank you for joining. Happy Friday, everyone. Happy Friday. Well, today is another session of Q&A with Dr. Mercy. I'm Dr. Mercy Ajonwe, and for those who do not know me, I am an internal medicine physician based in Texas. So I do a full-time practice in Texas, but on occasion I come on to Black Women Empowerment stream and discuss all things health. You know, my goal in all of this is to have all of us be well informed of the different health conditions or to prevent health conditions so you can actually know more about the conditions that I see in the hospital or just know more about just different conditions so that you may be able to prevent it, or if you have it, you can be able to have it treated optimally. Like I always say, prevention is better than cure, but knowledge is also power. So with that, we're going to dive into a topic that is very, very important. As you guys know, October is Breast Cancer Awareness Month. Thank you, thank you, thank you. Hi from Nova Scotia. Oh, wow. I'm here in Texas. Wow, that's a far ways. Well, thank you for joining. Really appreciate it. So like I said, we're going to be diving into breast cancer. Since this is Breast Cancer Awareness Month, I feel like it is very important that we discuss things concerning breast cancer. Given that this is this is Black women empowerment, breast cancer and Black women, there is some things that happen when you are a Black woman. You're more likely to have a certain form of breast cancer. So it's really important that you hear this message of this day. So I'm just going to go ahead and start the presentation. Thank you guys for tuning in. And just a moment, let me make sure that I'm able to. Okay, great. Okay, and let me make sure I am able to move. I'm able to move. Just one moment, you guys. Okay, so like I said, we're talking about breast cancer, and our goal is to kind of be more informed. Okay, so breast cancer is the most common female cancer in the United States. It's the second most common cause of cancer death in women, and the first being lung cancer. So the whole goal of just awareness of breast cancer is the screening part of it, because if you get screened, you're able to pick up breast cancer in its earliest stage, and the likelihood of you having a recurrency of this breast cancer is rather low. So that's why it's always important to be aware of it. There's different types of risk factors for breast cancer. From if you're taking hormonal therapy, that increases your risk. alcohol and smoking and even obesity increases your risk of it. Your age, sometimes your age can contribute. Genetics, and that's very key, very, very, very key. If you have a mother, grandmother, uh, aunt that has breast cancer, if they have a certain gene of this breast cancer, there's a high chance that you may carry that same gene that may invoke breast cancer. So it's really, really important to very be aware of your family history, especially when it comes to the various cancers, not just for breast cancer, colon cancer as well, but in particular for females, breast cancer. Diabetes can increase your chance. If you have a history of previous radiation to your body, particularly in your chest area, that also increases your risk factor. And then, depending on certain pregnancies, that can also affect it as well. So, what are some signs of breast cancer? Well, very simple. The first thing first that everybody always talks about is having the lump. So as you're, maybe as you're taking a shower or taking a bath, you feel your breast and you feel a lump there. That's the first usual most common sign. But there's other signs that you should be aware of. Things such as dimpling of the skin. You're like, what is dimpling? Well, dimpling, if you look at a orange, do you see sometimes when you look at an orange, the orange is not all oranges are particularly smooth. Sometimes there's these like deep depressions, on the skin. That's kind of how dimpling is. It's like when you have these like little like deep depressions on the skin itself. Um, Also, another sign is if you see asymmetric breast, meaning one breast is bigger than the other or one breast is smaller than the other, they're not the same in terms of size and shape, then you know something may be up. When you actually look at the color of your skin on your breast and you see change of color, sometimes it's redness, sometimes it's blackness, that could also be another sign of breast cancer. If you start noticing some discharge coming from your nipples, that's another sign. Sometimes people see blood there, sometimes they see abnormal colors, or you could be just, having just a discharge and you're not pregnant, you're not lactating. That can be a sign. And lastly, your nipples, if they start pulling inward instead of being outward, they start pulling inward. That is also another sign as well. So as you see the imagery over there, there's some imagery there, swelling of one breast or both. That's the sign of this asymmetric shapes of the breast that I was talking about, the lump, like we said. You can also notice lumps under your armpits, or like I talked about, changes in the skin of the breast, either the color changes or just the depression that I was referring to. We talked about discharging and dimpling. So when you even before you have those signs of breast cancer, like we just talked about, it's important to get screening. So the most common screening is typically a mammogram. And if you see over here, you see this lady who has her front towards a machine here. This is typically how that mammogram machine looks. And what it is really a form of an X-ray, where they take an X-ray of the breast. And as you can see here, the provider or doctor is looking at a screen, and this is how typically the X-ray imagery looks. So what they're looking inside there, looking for any abnormal lighting of tissue. So they know how the breast looks like. So if they see an increased area of lighting, then they're like, that may not be something that is normal. And so that's the mammogram, right? It's very fast, very quick. You're in and out. And so, it's something that is highly recommended. Okay. Thank you so much, Yvette. Um, Other imaging that can be done for the breast is the ultrasound. Now, when you feel a lump, sometimes the first thing you should do is go to your doctor. Hey, I feel a lump in my breast. and the doctor will also feel it. And sometimes it may feel rubbery, sometimes it may feel like there may be fluid there. So, they may recommend or ordering of the mammogram, but they also may also recommend an ultrasound. And an ultrasound kind of looks in the tissue of the breast to see, is it a solid lump or is it something that's kind of fluid in nature? Okay, a solid lump a lot of times can indicate a form of Barbados. Hi. South Carolina. Hi. Thank you, Yvette. Thank you so much. So, breast ultrasound, usually, if you see a fluid or a solid, they can kind of give you clues as to what it is. If it's a fluid, it's usually what we call cystic. And there are, a lot of times in general that could be considered benign, but not all the case. It's not always the case. And if it's a solid, there is a likelihood it could be something that's worrisome, but it's not always the case. But we use an ultrasound to kind of look at the character of that lump. Also, they may recommend an MRI. Hello, how are you? Hello, thank you for being here. They may recommend an MRI, and that MRI is particularly for those who have very dense breasts, because we all have different forms of breast. Some may have more tissue in their breast than others, and so that tissue may hide any abnormal tissues that are within it. So they may say, you know what, we need an MRI that can really look at the individual tissues, and we can be able to expose everything. So that may be the reason why, if your doctor recommends an MRI, that may be the reason. But what I want you to gain from all of this is screening detects breast cancer early. That being said, it's if we go to the next slide, let me go this way. Yeah, sorry. If we go to the next slide, and you may not be able to see this because it's kind of faint, so I'll try to explain. If we go to the next slide, there are different organizations, like medical societies and organizations, that recommend screening to be done at different ages, okay? In general, if you have a family history of breast cancer, you need to talk to your doctor. They will give you a sense of whether or not you should do it sooner or later. Like, for example, if your mother was diagnosed with breast cancer in her 30s, don't wait till your 40s to now ask if you need to get screening done. Get it as soon as possible. Start talking to your doctor as soon as possible, because again, if you detect it early, there are treatment options that you can do whereby breast cancer would not be an issue for you. So if you have a strong family history of this, go ahead and get checked, and then figure out, and your doctor can figure out the actual age you should start getting the screening or the mammogram. But for those who don't have a family history of it, the different medical societies have deemed them of average risk. And those who have average risk, there are some that say, yes, start at age 40 for a mammogram, where others are like, I think we can wait till 50. So I think the general consensus is talking with your doctor. They can be able to tease out what your risk factors are. If you are a smoker, if you have a family history of breast cancer, yeah, you're probably going to get it sooner than someone who's maybe more healthier, not drinking or not drinking alcohol or smoking. They may be able to kind of push it later on in their years. The reason why there's a discrepancy is because there has been cases of people who have gotten mammograms rather early. And so the mammogram, it just notices abnormal tissue form. It cannot tell you whether or not it is a benign tissue or if it's a malignant tissue. And research has shown that sometimes when we're aggressive in getting mammograms, a lot of the tissues that they end up finding are really benign. And so they don't want an increased amount of biopsies if they don't have to. They just want to be able to biopsy, suspicious tissues and not have to biopsy all these what ends up being benign tissues. So that leads to, okay, once they do find an abnormal tissue in imaging, the next thing is a tissue biopsy, just so you guys know. And so they'll go in and get a tissue biopsy, and then they'll send it to the lab. The lab will look under the microscope and look for abnormal or malignant cells. And that's how they finally diagnose somebody with breast cancer. Then from there, once they notice that this is an abnormal tissue, it is likely malignant, they'll do some staining to see what kind of breast cancer it is, which will help the cancer doctors or the oncologist now create a treatment plan for you. So this is where the types of breast cancer now comes into play, and why early detection is key. So breast cancer can occur in any of these areas of the breast, okay? But a lot of times, like I said, you have the benign, which is tissue that is probably either your normal cells that just kind of got duplicated a lot, or for the most part, that's what it is. It's just a benign structure. It's not going anywhere. It's not being aggressive. It just happens to just be extra amounts of normal cells, right? It becomes malignant when these cells start turning to an aggressive form of cells where they're constantly reproducing and duplicating, and now trying to expand out of the area in which they were. I hope you guys, I'm trying not to get too technical, but I want you to understand the difference between a benign cell and a malignant cell. A malignant cell is that aggressive kind that just wants to just keep on reproducing and getting a lot, and starts to move out of where they were, starts to get out of the breast, eventually get into other parts of the organs like the lungs, the brain, that sort of thing. That's malignant. Benign, yeah, it's there, but it's there, but it doesn't go anywhere. It just stays in that area there, and you monitor it, and it really doesn't change, and you just leave it alone. Okay. So when you go to the malignant cells, which is breast cancer, the reason why you want to detect it early is, like, if you see this, they call it in situ, but what it means is you have these very malignant cells, but they have not expanded outside of the boundaries of the area of the tissue within the breast. So they're contained. When you have malignant cells that are contained, that's very easy for both the surgeons and the cancer doctors. It's not easy, but it's manageable for them to treat, because for the surgeons, they can just really just cut it out. And because it's contained, the likelihood of any other cancer outside of that area existing is rather small. But they still may require you to have chemotherapy just in case there were some tissues that may have gone beyond the structure that they cut out, so that they can make sure it's all gone. It becomes what they call invasive when now these aggressive cells get out of that structure within the breast, and they start growing outside of it. They're still within the breast, but they start growing outside of the structure that they were initially housed. That's when they call it invasive. Again, it's kind of, okay, get it as soon as you can, cut it out as soon as you can, use chemotherapy as soon as you can, so it does not grow more. When it becomes metastatic is when it's now outside the breast. Like I said, it goes into the bloodstream. The cancers go into the bloodstream, and now you see it in the liver. Now you see it in the bone, in the spine. Now you see it in the brain. Now you see it in the lungs. Now that's why they call it metastatic, because it's gone outside of the original organ, in this case the breast, to other parts of the body. Now that's harder to treat, but there are still treatments for it. So long story short, prevention is better than cure. Not only that, um, early detection is key. So if we can get it in this stage, it's easier to have it where you don't experience reoccurrence of the breast cancer years out. Okay, I just wanted to show you that as a visualization so you understand why why it's key to get checked. And when it comes to Black women, there is a type of breast cancer that's the most aggressive kind that Black women tend to get twice as likely than white women. But this cancer is relatively, the predominance of it is relatively low, meaning 15% of all breast cancer tends to be this form of cancer, and that is triple negative breast cancer. But within that 15%, Black women tend to get it twice as likely than white women. And once you get it, it's so aggressive, meaning by the time you sometimes get detected, it's already been metastatic or invasive. So, what does it mean by triple negative? Well, a lot of these breast cancers, just not to get too technical, a lot of these breast cancers have on them. If you look at this first image, tend to have these receptors where they call hormone receptors. These are receptors that they use. A lot of them feed off of hormones, okay? Our hormones like our estrogen, our progesterone. The hormones are sex hormones that are flowing readily in our body. And so they feed off of that. Well, some of these breast cancers have the receptors to get those hormones. Well, chemotherapy, there's some chemotherapy drugs that go against these receptors so that they don't get these hormones. And as a result, those cancer cells start to die. And so for those that are cancers that are receptive, that have these hormone receptors, the likelihood of them responding, meaning getting killed by these chemotherapy drugs, are higher. So those are the typical types of breast cancer. When you have triple negative breast cancer, you don't have those hormone receptors on your cancer cells. So as a result, some of the common chemotherapy drugs that can help kill the cancer cells and other breast cancers doesn't really apply as much. It's not to say that it does not kill ever, but the chances of it, the chances of the rate of which it regresses are a lot smaller compared to the other types of breast cancers that have these hormones. So again, the moral of the story of saying all this is early detection is key. So that concludes that concludes my presentation. I wanted to just close out this October month just saying, breast cancer awareness is important for us as women in general. And if you have not gotten your screening done, first of all, figure out if it's something you need to do. It does not take it's just really quick, simple. And, the sooner you're able to be detected, the better it is for you. Thank you so much, Carlita, for your comments about this. It says, thank you so much for this valuable information. A friend advised that when we schedule/confirm our annual 3D mammogram, we should also want to get ultrasound/MRI if we're told that we have dense breasts. Our HMO/medical plans covering this requires special referrals? So that's a good question. I believe that they are covering it, but I don't know each and every HMO/medical plans, but I think they should be. I know they definitely cover the mammogram. And yes, for those who have dense breasts, yes, that's what they do recommend. But also, if the radiologist cannot see, because they can see in the mammogram whether or not you have dense breasts or not. So a lot of times they recommend in their final assessment report that you should refer this particular patient to get an MRI or an ultrasound due to the fact that the breast seems to be dense on the x-ray. So that's a great question. Thank you for that. And yes, Margarita, I hope I said that, or Margarita. I had a lump a while back and they used a needle first, but as I said, this was a while back. Yeah, so again, I don't know if you got the ultrasound, usually they do that. And if they did, then they do a needle biopsy. So you probably they did the imaging, saw it was solid, then they did a needle biopsy, they took it to the lab, and then they did some special staining to see whether or not it was malignant or not. And a lot of those, even if you have a solid, let's say you have they say, oh, you do have a lump and it is a solid lump. A lot of times it can be still malignant. So don't freak out. Excuse me, can be still benign. I'm sorry. So don't freak out like, oh my gosh, I have cancer, I have cancer. No, studies have shown that a lot of those biopsies, a lot of times they come back benign. So again, it's just, making sure that it is not malignant. All right, thank you guys for another great conversation. And I hope to be coming on live just to continue our conversations about different conditions, different ways to optimize our health. So I hope you guys have a great rest of your Friday. And until next time, bye.